Movement is the essence of life. We climb stairs and button shirts. We race marathons or play the violin. We reach out a hand to our loved ones. Over 7 generations and across more than 150 countries, Hospital for Special Surgery has unleashed the liberating potential of motion through a relentless pursuit of musculoskeletal advancement, helping millions enjoy active and healthy lives. Musculoskeletal conditions, including arthritis and back pain, autoimmune diseases like juvenile arthritis and lupus, and degeneration or injury to bones, tendons, and ligaments, are just some of the conditions that form one of the world's greatest health challenges. In the U.S. alone, these conditions affect over 127 million people each year, at a cost of $874 billion, almost 6% of our GDP. And the challenge they present will only grow. As the world's leading and largest living laboratory for orthopedics and rheumatology research, HSS is uniquely capable to meet this challenge. Ranked number 1 in the country again and again, HSS continues to disrupt orthodoxy with groundbreaking discoveries that enable new interventions and techniques. From designing and developing the first modern total knee replacement to identifying the biomarkers that may predict orthopedic implant loosening, to linking the JAK-STAT signaling pathway to rheumatoid arthritis, which led to an FDA-approved therapy to stop the disease's symptoms and progression. Our work sets the benchmark for musculoskeletal care across the globe. Today we're doing even more. Over 300 scientists and support staff work across 20 labs and clinical services in our research institute. To address the epidemic of disease and pain and enable people to live better, HSS is expanding research in 3 critical areas: prevention of tissue degeneration, tissue repair, and tissue regeneration. At the Center for Prevention of Tissue Degeneration, we investigate the mechanical factors and molecular pathways that cause injuries, stress, inflammation, and aging to compromise musculoskeletal tissues. Our goal is to reduce, or even prevent, tissue degeneration, keeping people of all ages active and able to lead productive and fulfilling lives. To give just one instance, in a landmark discovery, scientists at HSS linked interferon, a protein involved in immune system activation and inflammation, with lupus. Today, we're exploring revolutionary ways to inhibit interferon-related molecular pathways, preventing the immune system from attacking its own tissues in lupus and other autoimmune diseases. At the Center for Tissue Repair, we investigate causes of poor tissue healing in orthopedic conditions, arthritis, and autoimmune diseases. We use approaches that integrate basic science and genomics with precision medicine. Our aim is to help the body heal itself, developing new therapies that target inflammation and growth pathways to repair the musculoskeletal system. For example, HSS scientists have identified molecules and pathways important for the function of cells that repair bones, cartilage, and muscles. They are using this knowledge to develop new therapeutic approaches to restore function to patients with arthritis and prevent major surgical complications, such as implant loosening. At the Center for Tissue Regeneration, we seek to cure the incurable, working with tissue damage too advanced for current medicines to treat. We combine disciplines from orthopedics, tissue engineering, developmental biology, epigenetics, stem cell reprogramming, and imaging. We seek to rejuvenate and replace destroyed tissues to restore mobility, truly enabling healthy longevity. In one current project, scientists at HSS are developing new biomaterials, such as scaffolds and hydrogels, that can be seeded with stem cells to create replacements for injured or degenerated menisci and tendons. These biomaterials are customized and can integrate seamlessly into the native knee. We are also developing approaches to reprogram cells to reverse the effects of trauma, degeneration, or even aging on musculoskeletal cells and tissues, such as spine discs and tendons. This has the promise to create a young tissue environment, which will transform the lives of patients suffering from back pain and tendinopathy. Every day, the HSS Research Institute and its research centers are unlocking possibilities once deemed unthinkable. Together with our generous supporters and leaders across the enterprise, HSS will further advance the field of musculoskeletal health so people across the globe can move better and live healthier, more fulfilling lives for generations to come.